Dr. Gorana Petzovic.
Close enough.
Hello, how are you?
Hi, very good today.
What a lovely place.
Yes, we're blessed with a super space to work in.
With Dr. Gorana, right?
Yeah.
Gorana, I got it right. We're going to talk about mesotherapy.
Correct.
Let's discuss this.
Sure.
What's mesotherapy?
So mesotherapy is probably the entrance treatment that brings most people to our clinic. It's a treatment which can be performed on young skin and aged skin, so that's always a plus because people think that they can come here only if they're aging.
If they're aging,
or have problem
lines.
From time to time, I will translate in more.
Sure.
So, bażikament li tajt Dr. Gorana hija li l-mesotherapy interpretazzjoni ħażina tagħha xi jaħsbu li jiġu għaw nies ta' ċertu età. Imma din miżinterpretazzjoni fil-fatt anke nies ta' età żgħira wkoll jiġu.
So, a lot of people spend a lot of time and money on products, cosmetics, creams.
True.
There's all sorts of things out there, which unfortunately most of the time are just gimmicks. They're branded well, but they tend to not work. So what mesotherapy is it's a very simple cocktail, which includes very basic ingredients, active ingredients, which are going to help the skin either improve the hydration of the skin, improve the collagen production of the skin, and kind of help you age more gracefully or help the skin age more gracefully.
Fil-fatt qed tgħid Dr. Gorana li hawn ħafna kremiet fis-suq li jkunu wkoll għaljin imma
ħafna nies jonfqu ġidhom fihom.
Ekku mhux possibilment jagħmlu l-effetti li aħna nixtiequ jkunu markitjati tajbin imma mbagħad l-effetti ma jkunux dawk mixtieqa. Sa il-mesotherapy li tagħmel huwa li ittik ħajja il-ġilda u mbagħad ovvjament tgħidilna kif il-proċedura u naraw ukoll
Jagħmel l-istess xogħol ta' daw il-kremi li jdumu forsi biex jekk tara differenza tara riżultat fi żmien twil u bil-mesotherapy tara riżultat fi żmien qasir.
And we age gracefully kif jgħidu.
Exactly. So it's inevitable. We're all aging and we're all exposed to different external factors which don't help with aging. In Malta, it's particularly bad
at
because
50 we cannot look 20.
No, and we don't want to look 20
to look
at
50 but gracefully.
You want to look your best at 50. Yes, absolutely. So you want to help your skin age as slow as possible, but not stop it. You can't stop aging. So the main difference between topical creams or ointments or whatever people are buying and mesotherapy is that the cream is applied on the surface of the skin and can penetrate to a certain depth, right? With mesotherapy, with the needle, we go a little bit deeper than that and we target the correct layer where these active ingredients will work differently if they're applied into that layer as opposed to on top. So essentially, where the delivery of the product
is more effective.
Exactly, it's targeted. So yes.
Qed tgħidilna li l-kremiet huma fuq is-surface fuq wiċċ l-ewwel layer tal-ġilda jew naqra iktar fil-fond, però il-mesotherapy tidħol ħafna iktar fil-layers tal-ġilda fil-staffi tal-ġilda, allura għalhekk hija daqshekk effettiva iktar mill-creams.
Għax jidħlu bil-labra. Allura jkunu jistgħu jittargetjaw fejn jiridu jdaħħluha eżatt.
Proċedura da ma qaltilniex eżatt.
Eżatt. The procedure of the mesotherapy.
So, as I mentioned a minute ago, it does involve a needle. It's a very tiny needle. It's one of the thinnest needles that we have. And we very superficially inject little droplets of a combination of ingredients depending what we're targeting. So most of the mesotherapy products contain hyaluronic acid. It's something which our skin contains naturally.
Already?
Exactly. And it has a fantastic ability to absorb and hold 1,000 times its weight in water. So when you inject a little drop of mesotherapy product all over your skin or all over whatever area we're treating, you get 1,000 times water molecules sticking to this hyaluronic acid. So you get this very subtle, it's not going to change your face, but it's going to plump your skin up. So you're going to feel more hydrated, you're going to get more of a glow. So that's what people love about this treatment.
Is it for wrinkles or fine lines or none of them?
It's for fine lines. So fine lines are a type of wrinkle, right? So it's actually great for fine lines because other procedures and treatments that we can do, they're very difficult to target fine wrinkles. So mesotherapy is great because we inject all over the face. It's diffuse. We're not targeting just a cheek or a frown. Exactly. And fine lines are generally quite superficial. So we can fill in all these fine lines with these little drops. And the nice thing about mesotherapy and this hyaluronic acid that it contains is that it's very fluid. So it's kind of like injecting little drops of water without having any bumps, any change of volume or anything of the sort. So you're just going to
have an
improve,
even.
Improve the surface of the.
You have a nice glow, right?
Glow and texture as well. You restructure the skin.
What age are we targeting here?
I'd say 30 plus.
Okay.
Because that's when people start to see changes in their skin. Obviously, you have people who are younger than that, who spend a lot of time outdoors, who spend a lot of time.
Genetics as well.
Yeah, genetics doesn't help.
People who have a condition like seborrheic dermatitis or psoriasis, is there any condition which you can't apply mesotherapy on?
So we generally don't apply mesotherapy on damaged skin. So if your skin is not intact and healthy, if you have any kind of infections, any kind of chronic inflammatory diseases,
you need to treat that first.
Exactly. It doesn't make sense to inject mesotherapy on already sensitive and vulnerable skin. You won't get the desired effect. So no, we avoid. We cannot help the condition by mesotherapy, so we treat it first, make sure the skin heals, and then if it is possible, we go ahead and do the meso.
Perfect. Like biex tipprova xi ħaġa.
It's interesting.
Għax aħna għandna l-impressjoni, sorry,
No, I'll understand.
Jiena ħaniħu minni jiena. Nibża meta niġi biex imbabaswit.
Afraid of?
No, I'm being the stereotypical person who is afraid.
Let's convince her.
Exactly. People at home who are watching us may be afraid of the fear of the unknown, which, okay, you're gonna inject me, but what is the outcome of it? Do I have to stay for a whole week indoors because my face will be bruised?
Good point. So, are there any side effects?
So, first, the fear. It is a procedure which is slightly uncomfortable because we are injecting a lot of droplets all over the skin. We do apply anesthetic, local anesthetic, on the areas about 30 to 45 minutes before the procedure. So clients generally come a little bit earlier. We apply a thick layer of local anesthetic, and that improves the overall procedure. It's a fast procedure, so it takes anywhere between 10-15 minutes. You're just kind of, once you get a rhythm, and once people get used to the pricks, the constant pricks, then it's mostly very tolerable.
Tibżam il-pricks into? No. So, one to go.
When you plug your eyebrows
yes,
for the
exactly.
first time, it's
exactly. Yes, I mean, waxing hurts.
Exactly.
Everything. Pain is beauty.
Pain, no gain.
She's not bothered about pain.
The pain.
Oh, that's sorted.
So the second most common side effect and undesired effect is bruising. We have little vessels all over our face. So unfortunately, when we go in with a needle, we can't see all of them, and inevitably we hit sometimes. So that means you end up with a little bruise. Generally, it's not larger than 0.5 centimeters, and like any other bruise, it resolves over a couple of days, and there's no long-term permanent damage. You'll have some small bumps for maybe the first 24 hours. You'll have some red dots, obviously, around the face. We like people to come in either in the evenings or before the weekend, so that they have at least 24 to 48 hours recovery, but that's it.
And the effect afterwards?
The effect is incredible. I mean, you can't get the same effect with any other treatment. As I said, it's diffuse. So you see you see an overall glow all over the area that we treat. The skin is glowing, it's hydrated, your moisturizer sits better, your makeup sits better. People will notice that you look more rested. It treats a little bit that discoloration under the eyes, so you get, this. It's a rested, fresh, glowing look, which everybody is after, I think.
Exactly.
X'taħseb? Jridu nagħmlu aħna.
Jaġobni,
Thank you, Dr. Gorana.
You're very, very welcome.